Joining us now, our good friend Sean Connaughton. Sean is the president and CEO of the Virginia Hospital and Healthcare Association. Sean's a military veteran who has worked in the Bush administration and the McDonnell administration in Virginia. He's a friend of the program FOJ, and like yours truly, a supporter of President Trump. Welcome back, Sean. And Sean, before we get started, hey, man, it's great to have you.
Hey, John, good morning. It's been a while, so it's good to renew my FOJ card.
FOJ cards, got to get renewed. Okay, before we get into your poll and stuff, the things you did, I got to play this clip here by Dr. Fauci, because you're president of VHHA. Dr. Fauci yesterday saying, well, I think we got to cancel Thanksgiving. No turkey for you. Cut 25.
I think given the fluid and dynamic nature of what's going on right now in the spread and the uptick of infections, I think people should be very careful and prudent about social gatherings, particularly when members of the family might be at a risk because of their age or their underlying condition. Namely, you may have to bite the bullet and sacrifice that social gathering unless you're pretty certain that the people that you're dealing with are not infected. Either they've been very recently tested or they're living a lifestyle in which they don't have any interaction with anybody except you and your family. Then it's okay. I mean, it's almost like my relationship with my wife. We almost do nothing with anybody else except each other. So I'm not worried about my infecting my wife or my wife infecting me. You take my sister and my brother-in-law, they're the same thing. They almost never go anywhere socially of being in contact with other people. You would say that kind of a gathering would be really relatively safe. But when you're talking about relatives that are getting on a plane, being exposed in an airport, being exposed in a plane, then walk in the door and say, Happy Thanksgiving, that you have to be careful.
No Thanksgiving for you, Sean. Sorry. Dr. Fauci says no Thanksgiving. Oh, well. I used to enjoy Thanksgiving and have the family over, and my kids come in from Atlanta, Mississippi. We have a big dinner, but I guess we can't do that now. Thanksgiving canceled by Dr. Fauci. Sean, what do you think?
Well, I'm going to pull one thread that he highlighted in his comment, and that is, when we have big events, we bring in particularly family members, older family members, and just last week, we came out with a very detailed analysis of the first quarter of hospitalization. So we have all the details for the first big tranche of COVID cases that hit Virginia and the people that went into the hospitals and those who unfortunately expired. And it really validates this concern, particularly about about older Virginians, older Americans. I mean, what we found is that overwhelmingly the people who have been hospitalized, the median age, I think, was in the high 60s, early 70s. They have a lot of comorbidities, and that these people are the ones really, and again, you look at this across the board for those who have passed away from this, or almost all, I think it's almost 90% are above 60 years old. You look at all that data, and what do we do at holidays? We bring the whole family. You bring your grandparents, your aunts, and those who really are the ones most at risk. And that's what we have to keep in mind as we go forward here. We're really proud of Virginians and how they have practiced social distancing, how they have made sure they're always washing their hands and attempting to avoid big crowded events and environments. That has actually helped Virginia. We've had challenges, but we haven't had the challenges you've seen in other states. And we just did a poll. You mentioned the poll, John. And it was amazing just to see the numbers, the overwhelming majority of Virginians, like in the 80s to 90%, end up following the general guidelines, just being prudent about how they carry themselves, how they interact with people. It is difficult during holidays. I'm going to go back to that. I mean, we can, you can do events and family events, but you got to also think about the fact that the most vulnerable people to this virus are our older relatives, and the ones who really, when you look at overwhelmingly who have passed away from this, are people over 60 years old. So think about your Thanksgiving table, who's sitting around there. Maybe you just kind of keep that in mind.
Well, I mean, look, that's been the whole mantra here is you got to protect those that are vulnerable, people that are sick. My mother just passed away a month ago. We have her celebration of life party on Sunday. So she passed away a couple of weeks ago. We certainly wouldn't expose her to it. We knew if she got it, she's getting pneumonia, she's dead. She passed anyway. But so you protect the vulnerable. But this idea that you can't have Thanksgiving, you can't do anything, you can't go out. Look, Sean, you got to live, okay? And I think you're right. Virginia's done an excellent job. And I want to talk about that a little bit because we're 8 months into the COVID-19 experience. There's a lot of confusion, a lot of fake news out there. Now we find a report in the CDC that says, well, for the people that got COVID, 85% of them were relentless mask wearers. So that brings the whole mask thing into question. Does it really work? Obviously, it didn't help 85% that got sick. The President First Lady, they got it. They recovered without incident. They get the same care that anybody else can do. Other people, obviously, old, not so fortunate. And then you look at the other thing, Sean, and I just want to get your comment on this. When you take out comorbidities, the CDC, this is right on their website, only 6% of people have actually died from COVID of the 210,000 without some other kind of underlying condition. So the COVID test is actually 13,000, not 210,000, because the other number, the 94%, they had something else wrong with them, and the COVID-19 exacerbated the comorbidity. So there's a lot of confusion. But for the big picture, what are things looking like in Virginia, Sean Connaughton, going forward?
Well, obviously we're learning. I look back at when we started getting ready for this. We first knew something was happening back in January, February, when we were getting the reports out of China, and then we got our first case in Virginia in March, and we've been working it since that point. Our association actually works for the state under when we have a thing called VHHA, the Virginia Healthcare Emergency Management Program, and so we actually manage the hospitalization side and the regional coordination on behalf of the state. I'm looking back where we started, John, to where we are today. We've learned an enormous amount about this virus, and unfortunately, people, what we've learned is that some of the earlier assumptions we made were wrong. Some of the earlier assumptions we made were right. We're getting better at treating it. In fact, we're seeing that those who are hospitalized are staying in dramatically, shorter periods. If you just look at the president and the amount of time that he spent in the hospital, that really wasn't anything special for where we are today. I know people have said, you got special treatment. In reality, that is now where we are when people do have it, and they're able to, we get it early. They're able to come in and get treated and stabilized and sent on their way. The issue is, John, is we still have a very, very small proportion of the population has gotten this virus. And so we really do need to be starting to focus now on this issue about vaccinations, and that's what we're preparing for right now. We're working very diligently with the state and other partners to get ready for a vaccination, and how do we end up implementing it? Because the bottom line is that we still have only had a very small number of people get this, and that means that there's still a pretty big population. There's discussions about herd immunity. The more we open up, the more we're going to interact with each other, the more we're going to see the numbers go up. It's just, for people, they just have to be prudent, and they have to think what it is, and what we're understanding is more. We understand that social distancing does work. We understand masking does work. We do understand that constantly washing our hands or using, some sort of sanitizer does work. But
all good things. Washing your hands, good thing. Right? Never a bad thing to keep your hands clean and keep the germs off them. No question about it. Sean Connaughton. Sean is the president and CEO of the Virginia Hospital and Healthcare Association, VHHA, the acronym there. He's a military vet. He's worked in the Bush and the McDonnell administration right here in Virginia. Sean, let's talk about hospitals because that's who you represent. One of the things I wanted to talk to you about today, a lot of people with COVID get in hospitals, but what is happening with hospitals in Virginia? How has this impacted their ability to serve other patients financially? What's the impact been?
Yeah, John, going back to one of the reasons we help run this emergency preparedness program for the state is that Virginia has a very limited public health footprint and only a couple of publicly owned hospitals, that is UVA and VCU. All the other hospitals in Virginia are privately owned. And so one of the things that people now really don't take for granted anymore, this incredible hospital system we have in Virginia. It's been there. It's been serving people since the beginning and done so in an incredible fashion that has, we've seen, in fact, the poll has shown dramatic rise in the amount of support and favorable views of Virginia's hospitals. All that being said, we are private sector. And so, at one point, we closed down all elective surgeries. We didn't know, again, what was going to happen when this pandemic first hit, how many people we would end up having to potentially treat. So we actually voluntarily shut down all elective surgeries to make essentially open up and be ready for what we thought would be a very large number of patients. Right after we did that, then the governor went and issued a moratorium. The challenge is that then that means for a few months, we essentially had no revenues coming in, at least from a large section of our business.
Wow.
And now, on top of it, even now with reopening, we're not back to the volumes we once had. And our concern is twofold. First is we're seeing that people are deferring health care, which means they're going to potentially have more problems going on. So we have a public health crisis that's coming from not getting care during the pandemic. Then on top of it, we're just not seeing people wanting to come back at all to get necessary procedures. That has an impact, obviously, on our finances. And then you look at, John, one of the things that we're really worried about, there is a hidden, another pandemic on behavioral health and domestic violence. We're not seeing, because we don't see these things, what's going on behind those people's closed doors. So it's had a big impact on us, and we're continuing to have that moving forward.
I know you're there helping these hospitals navigate their way through it. They got some relief with the CARES funding, but nowhere near the money that's been lost, the revenue, obviously, from the elective surgeries and other things that have been shut down. Sean, I want to shift gears for a minute. You talked earlier, you said you guys did some polling. Can you tell us what it was and what you found out?
Yeah, John, so we try to do once a year a poll just to gauge where our standing is with people and also to see where people, where they are on issues of, involving healthcare. This year we asked a lot of questions about COVID and what people are thinking and what they're doing. And so that poll, first off, showed a very, very significant increase in favorability of hospitals. It went through a lot of these issues on the pandemic and what has happened, what people are doing. And again, we were very, very happy to see that Virginians overwhelmingly are taking this seriously and protecting themselves and protecting their families. We also we're asking questions about vaccinations because that is our next big issue, and whether people are going to get vaccinated. And right now, what
was the reaction to that?
Actually, there was a minority said that they would get it once it became available. And
what was that? What was the number?
It was less than 40% said they would most likely get it.
I mean, I'm going to ask my listeners now. You can text me 757-692. If a vaccine came out tomorrow, would you take it? The government sanctioned it, said, okay, here's a vaccine. Would you take it? I'll start. No, I wouldn't. Not that I'm an anti-vaxxer. I'm just not. But, with my family, probably I would encourage them to do it. I wouldn't do it. But anyway, text me, 757-692-1710. If a vaccine came out tomorrow, would you take it? Yes or no? Just give me your response to that. So 38% said they'd take it. When you asked people about social distancing, mask wearing, what was the response to that, Sean Connaughton?
Oh, very, very high. I think it was over 90% ended up saying that or about 90% said they did wear a mask, consistently. And so, hey, and John, I want to come back to this vaccine issue. I want to go one step. We asked that initial question, and it was sort of interesting when we asked why. The vast majority were like you. They don't want to be the first ones. And so there are people who would say they would get a vaccine once it was up, running. We understood a little bit more about potential side effects and the effectiveness of it. And once that happened, we actually had a pretty significant majority said they would get a vaccine. So we understand that. We understand that people are concerned about it. We're going to be working through it, messaging. We have to understand what vaccine we're going to get. I mean, right now there are probably a dozen different vaccines that are moving through the system, and all have different ways to apply it, and have different types of protocols involved. But we were happy to see that people, after the first initial batch comes in, people were willing to get it after they saw, what the impact is.
All right, so I got a couple of responses here on the vaccine. Michael in Chesapeake says, yes, absolutely, if it means I no longer have to wear a mask. Jennifer in Norfolk says, I'm physically active, I'm 50, I'm slim, with a great diet. No, I wouldn't take it. I don't take flu shots either. And Christine in Washington, D.C. says, hell no. Den in Chesapeake says, I'm not getting it either as my wife. Nick in Virginia Beach says, hell no. So a lot of people. I wouldn't get it simply because I'm healthy and I'm just not going to live in fear. We decided a long time ago, if I get it, maybe I've had it, I would have no idea. But if I get it, I'm going to be fine because I'm 62, healthy. I have enough meat on me, as everybody knows, where that's not going to be an issue. So maybe it'd help me lose weight. But now for my family, it's different. Like our son, we vaccinated with every vaccination out there. So we're not anti-vaxxers. For me, it's like, whatever. We'll see. But the mask thing's interesting. So 90% of people that you polled think have no problem with masks.
Yeah, in fact, we ended up having, it ended up being 89% exactly said they wear masks out in public.
Well, I wear a mask. The thing I found with masks is, look, I don't think it does anything. That's just me. I don't think it protects anybody or protects me. But I wear it out of respect because some people believe it does. And so it's just no skin off my back. It's just not a big deal. And the people that are like anti-maskers, I'm like, why do you fight this? Put your mask on. It's no big deal. In fact, what I do is I make them stylish, and I also put masks on to aggravate New York fans, Yankee fans, and Washington National fans. Like right now, Sean, when I go out today, I'm having on my Astros mask.
John, I want an FOJ mask. Do you have any of those?
I'm going to get you one made. Friend of John. FOJ mask. If it's a good thing, it's a good thing. If it doesn't do anything, Sean, are you any worse off, Sean? Is there any downside? No.
Listen, actually, in some ways, like you said, masks are becoming the new ties.
I love it. John Fredericks Radio Network. Sean Connaughton. Sean, thanks for being with us.